Have you ever felt so anxious about your health that it interferes with your daily life? If so, you may have experienced what is known as illness anxiety disorder. This is a mental health condition that is often characterized by an excessive worry about having a serious illness. You may have also heard it referred to as hypochondriasis or health anxiety. It's a fascinating condition that can sometimes be misunderstood, even by those who are experiencing it. It's not just about feeling a little worried when you're not feeling well. Illness anxiety disorder is a persistent fear that can have a significant impact on a person's life. It's a condition that can happen to anyone, regardless of age, background, or lifestyle. Today, we're going to delve into this fascinating and often misunderstood disorder. By understanding it better, we can help those who are affected by it and perhaps even prevent it from taking hold in the first place. So, what exactly is illness anxiety disorder? Well, imagine being constantly plagued by the fear that you might have a serious yet undiagnosed medical condition. You feel anxious, worried, and it's not just a fleeting concern. This is what people with illness anxiety disorder experience on a day-to-day basis. Illness anxiety disorder, formerly known as hypochondriasis, is a mental health disorder characterized by excessive worry about having a serious illness, despite having no or only mild symptoms. It's not just about being health conscious or cautious, it's an intense preoccupation that persistently disrupts daily life. Those with this disorder often misinterpret normal or minor body sensations as signs of severe physical illness. They may frequently seek medical tests and consultations hoping for reassurance, only to remain convinced that they are seriously unwell. Now that we know what illness anxiety disorder is, let's explore how it's diagnosed. Scene script: how do mental health professionals diagnose illness anxiety disorder? This intriguing question takes us to the world of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, more commonly known as the DSM-5 TR. This manual is something of a Bible for mental health professionals. It offers clear, concise definitions and diagnostic criteria for a vast array of mental health conditions, including illness anxiety disorder. So, what does the DSM-5 TR say about illness anxiety disorder? The first thing to note is the individual's preoccupation with having a serious illness. This isn't just a passing worry, it's a persistent thought that dominates their day and can't be easily dismissed, even when medical tests come back negative or doctors reassure them that they're healthy. Next, we see a high level of anxiety about health. This is more than just your average concern about catching a cold or the flu. It's an all-consuming anxiety that can interfere with daily life and make it hard to focus on anything else. Then there's the tendency to perform excessive health-related behaviors. This could involve constantly checking the body for signs of disease, repeatedly visiting doctors, or excessively researching symptoms and diseases on the internet. These behaviors often serve to increase rather than decrease the individual's anxiety. Lastly, for a diagnosis of illness anxiety disorder to be considered, these symptoms must have been present for at least 6 months. This isn't a fleeting fear that comes and goes, it's a long-term condition that requires ongoing attention and care. So there you have it, the DSM-5 TR criteria for illness anxiety disorder: a preoccupation with having a serious illness, high levels of health anxiety, excessive health-related behaviors, and a duration of at least 6 months. It's these guidelines that mental health professionals use when they're assessing someone for possible illness anxiety disorder. With these criteria in mind, what might cause someone to develop illness anxiety disorder? What factors contribute to the development of illness anxiety disorder? That's the burning question we're exploring in this segment. Let's dive into the possible causes. These are typically multifaceted and can vary greatly from person to person. However, there are some common threads we can pull on. First up is a family history of health anxiety. Just like eye color or a penchant for puns, anxiety disorders can run in families. If your parents or siblings have struggled with health anxiety, you might be more susceptible to developing illness anxiety disorder. It's a mix of genetics and environment playing their roles. Next, we have stressful events. Life isn't always a walk in the park, and sometimes it throws curveballs our way. It could be losing a job, going through a divorce, or experiencing a traumatic event. These high-stress situations can trigger anxiety disorders, including illness anxiety disorder. Last but not least, a serious illness in the past can also be a contributing factor. Imagine being really sick once. That's scary, right? Now, that fear can linger and morph into an excessive worry about becoming ill again. leading to illness anxiety disorder. But remember, these are possible causes. It's not a one-size-fits-all situation. Everyone's experience with illness anxiety disorder is unique, shaped by their own life experiences and genetic makeup. Understanding these causes can help us recognize the symptoms of illness anxiety disorder. And that's what we'll cover next, so stay tuned. What are the signs that someone might be struggling with illness anxiety disorder? The most prominent symptom of illness anxiety disorder is, as you might have guessed, excessive worry about one's health. This isn't your occasional concern about catching a common cold or the flu. We're talking about a constant, often overwhelming preoccupation with the idea that one has or is in danger of developing a serious, undiagnosed medical condition. This anxiety persists even when medical exams show nothing is wrong. Now let's delve a bit deeper. A person suffering from illness anxiety disorder often finds themselves frequently checking their body for signs of illness. This could be anything from obsessively monitoring their heart rate, repeatedly taking their temperature, to examining their body for lumps or rashes. It's like being on a never-ending treasure hunt. But the treasure, in this case, is evidence of a feared disease. Avoiding medical information is another common symptom. This might seem counterintuitive. After all, wouldn't someone worried about their health want to know as much as possible? The problem is, for someone with illness anxiety disorder, medical information can become a trigger. Hearing about a new disease on the news or even reading about symptoms online can send them into a spiral of fear that they are the next victim. Lastly, even minor physical symptoms can cause significant distress to someone with illness anxiety disorder. A simple headache isn't just a headache, it could be a brain tumor. A stomachache isn't just something they ate, it could be a sign of stomach cancer. This hyper-focus on bodily sensations can turn even the most innocuous symptom into a perceived death sentence. In essence, illness anxiety disorder transforms the body into a landscape of potential catastrophe, where every ache, every twitch, every irregularity is a sign of impending doom. Recognizing these symptoms is the first step to seeking treatment. If someone is struggling with illness anxiety disorder, what can they do about it? Well, tackling this disorder involves a multifaceted approach. The good news is that there are several effective treatment options available. One of the most common and effective treatments is cognitive behavioral therapy, often referred to as CBT. This form of therapy helps individuals understand and change thought patterns that lead to harmful behaviors or feelings of distress. In the context of illness anxiety disorder, CBT can help individuals challenge and change their catastrophic thinking patterns about health and sickness. It also equips them with coping mechanisms to manage their anxiety. Another potentially beneficial therapeutic approach is exposure therapy. This involves gradually exposing the individual to their fear or anxiety trigger in a safe and controlled environment. With illness anxiety disorder, this could mean visiting hospitals or medical settings, which may initially induce anxiety. Over time, however, this exposure can decrease the individual's fear response and help them manage their anxiety more effectively. Medication also plays a part in the treatment of illness anxiety disorder. Antidepressants, such as selective serotonin reuptake inhibitors, can help manage the symptoms of anxiety. However, medication should always be considered as part of a broader treatment plan that includes therapy and self-care strategies. It's important to remember that treatment is not a one-size-fits-all process. What works for one person may not work for another, and it often involves a combination of therapeutic approaches and medication. Therefore, it's crucial to seek help from a mental health professional who can create a tailored treatment plan that meets your specific needs. Let's not forget the importance of a good support system. Friends, family, and support groups can provide emotional assistance and understanding, which can significantly aid the recovery process. Remember, having an illness anxiety disorder does not mean you are weak or flawed. It's a real and treatable condition. With the right help and support, individuals with illness anxiety disorder can lead fulfilling, healthy lives. We've covered a lot of ground today on illness anxiety disorder. We've delved into its definition, understood the diagnostic criteria laid out by DSM-5-TR, explored the potential causes and identified the symptoms. We've also discussed the available treatments, paving a path towards recovery. This just goes to show how comprehensive and nuanced our understanding of psychology needs to be. If you found this video helpful, don't forget to subscribe to PsyEdu Insights for more insightful content on psychology. Thank you for watching.